this presentation is basically a reflection of the training experience that we have gone through since learning of of COVID-19 and its emergence last December. And I'm sure that's what I'm going to take you through. The stages that we experienced are not unique to Malta, but I'm sure that you will find the similarities with many of your own countries. So the setting which I'm going to be describing is basically more or less 1,000 bedded acute general hospital. And I say more or less because due to COVID-19, we've had to expand our bed space. We also had around 55 wards patient areas. Those are also fluctuating as we juggle with the COVID-19 situation. We have around 180 to 200 daily admissions with around 5,500 employees. Change slide, please. And I thought to depict the experience that we went through the past, I would say, a year and a bit more now, visually, by basically naming the stages that I felt that we as specialist nurses and the nurses on the ground, the general nurses, went through, because we went through this collectively. So I thought that we would start by talking about the awareness, the initial awareness that something was happening. This led to apprehension, and thankfully then there was a determination, a joint determination, which led to action. Eventually we've had to adapt a lot of things, and we're at a level of stability, which then gave rise to starting the whole cycle all over again, obviously with the waves that came along, the second and third waves. So let's start with the awareness stage. At this stage, we realized that a new important virus was emerging, and this was the stage where there were preliminary discussions at national and hospital level, where we were focusing on the acquisition and the availability of resources, particularly when we were focusing on the availability of resources in the acute areas, especially intensive care, and most of all, making sure that we had personal protective equipment items available to ride us through for what we knew was going to have a massive impact, but we had no idea when the end would be in sight. We still don't, in fact. At the stage, there were discussions on training plans, both internally and with our managers. How could we get nurses on the ground by involving the specialist nurses as well, trained and in being confident and competent in donning and doffing procedures and in knowing what to wear and in which situation. At this stage, we're also aware that there are going to be several troughs and peaks, and therefore we had to be prepared for these. And therefore training had to be an ongoing process, it was not going to end at any stage. Then we obviously got to the stage of the apprehension when we started realizing what was happening in the press. And these are just a few of the headlines that we were seeing. Apart from obviously other media, these were also some headlines in the Maltese newspapers that placed a lot of emphasis on the issue that there was a rapid increase in the incidence in Europe, but there was also a gross shortage of personal protective equipment all over the world, I would say. So at this stage, we also realized that coronavirus was on our doorstep, because we realized that suddenly it was in Europe, it was in Italy, and that's very close to us. And then things had to take a very fast pace from there. So we had to put hospital strategies into place where we had to separate COVID and non-COVID areas. Various guidelines and protocols were put in place. And the focus mainly was on seeking to increase the stocks of personal protective equipment and on ensuring gatekeeping as well of the personal protective equipment. So at this stage, we had to train the trainers, and this is where the specialist nurses in various fields came in. So the infection control specialist nurses led this, and we found a lot of cooperation from the other Maltese specialist nurses who worked in various different fields. So they had to obviously shift their skills. And sure enough, our first case in Malta was on the 8th of March of last year. And because of this apprehension, there was the need for particular mental health support. both within our unit, in the infection control unit, and this was readily available. The next stage was the determination stage. We had to learn and we had to teach very fast. So we ourselves as infection control nurses were learning very rapidly what COVID-19 meant, what were the implications for us and for the nurses on the ground and for the patients who were coming through our doors. It was a learning curve from the experience also in other countries for us. The good thing was that there was a we can do this attitude. There was a sense of solidarity. And we worked a lot with staff on the grounds in planning their services, in planning how they were going to work, and in reinforcing protocols in practice. Of course, you understand that this was a time when the nurses on the ground and other healthcare professionals went through a lot of anxiety. So we had to ride with that anxiety, we had to understand it, and we had to attenuate it as well. There was also the need for a lot of internal support at our unit level, of course, because we had to take care of ourselves to be able to support the people on the ground. The next stage was the action stage, where, as I said, we had to implement a lot of protocols, and this was where the gatekeeping came into place, where there was, we had to implement decision-making tools for the nurses and other healthcare professionals to decide which personal protective equipment to use and in which cases, obviously to make sure that they were always safe. In order for this to be credible, it had to be based on evidence. And in our encounters with people on the ground, with the frontliners, with the people who are actually delivering care, this is what was extremely important to remain credible. As I mentioned, we had to streamline the protocols according to various scenarios. We had to prepare teaching materials, of course, and in this as well, there was a lot of support from the nurses themselves. And it's kind of comical, but we had a war room set up almost for the rollout of training. The specialist nurses set this up, and the training was ongoing. It was almost back to back, and it was all day long, literally. There were people constantly doing session after session after session of training, because obviously we were pressed for time. So the specialist nurse's role was crucial. They had to become familiar in a very short time span with fast emerging hospital policies and protocols. And even though this was not necessarily related directly to their field of practice, it was an all hands on deck approach. They had to shift their focus from their area of specialization and move into areas, understanding why certain PPE were being used, understanding what COVID is all about. So they also had to shift their focus and be flexible. They also helped us reach out to more and more clinical persons in their respective fields. And as I said, this was a very rapid process with a focus on dissemination of knowledge and of skills. Then we got to the stage of adaptation, which I would say we are still in at this point in time. We had to get used to new styles of working and even in relating to each other. So if people were delivering patient care and then they sat down behind a nurse's desk to hand over to each other, they obviously had to learn that they can't just sit as they were before. They had to wear their PPE also with each other, which is something which they would not have done in other circumstances, of course. So there was a constant adaptation in finding ways of working by maintaining infection control, safety and principles. I would say this was the biggest challenge that we had, because obviously people have been working with each other for long years. They feel comfortable working with each other, but they tend to forget that there's a pandemic in process. So we had to keep reminding people of this. And this is why in the next point I mentioned the new reality of the increased possibility of encountering a positive patient, colleague or family member. And the training methods themselves also had to be adapted to maintain the public health policies. So where before we could, for example, cater for larger groups of trainees, now we had to make sure that we maintained social distancing, we made sure that we had enough videos, people were engaging in a lot of self-directed learning as well. So there was adaptation also in that area. And the final stage was the stage of stability, where there was a comfortableness in adhering to infection control protocols because people then were now very familiar with them. They had to remain vigilant, as I mentioned, especially with colleagues, because that is where they tended to possibly lower their guard. Using PPE according to protocol, and this was very important in safeguarding resources, and that is why it was so important that people knew why they had to wear certain PPE and not others in different scenarios. And they also needed to keep abreast with the evidence, and we needed to implement any required changes. So this was an ongoing process. In conclusion, I would say that this cycle is never ending. So it takes us back then to the next wave, where I would say in Malta, this stage was, we reached the stability phase, I would say towards June, July. And then towards the end of July, we started to see another surge in cases. That again brought us back to the stage of awareness. And I would say that we've been through the cycle all over again. In conclusion, I would say that this is a unique experience and continues to be so. Vigilance ensured that frontliners were never short of personal protective equipment locally. It has been a continuous professional learning opportunity, and it's also given us the opportunity to build meaningful relationships with our colleagues and to put infection prevention at the forefront. And at the side, you can see a picture of our infection prevention team, who obviously have been very much hands-on throughout the past few months of this pandemic.